Action Station, 1370 WOCA.
Ocala.
All right, 5 minutes after 9 o'clock, it is time for Veterans News. Hank Whittier is in the studio. Good morning,
That's
Hank.
right. Well, that's because so many people came here for me to pay my bills. That's why I'm here this morning.
You must
paying
owe a
them all
lot.
in cash, too. Hey, guys, good to have you. The VA's here. Dr. Baccio, Dr. Knapp. Appreciate it, guys. And Ray is here. We're going to talk. See, you want to mention his name to me? Okay.
Ray Seaman.
There you go.
I'm here.
And Don's here. That's all that counts, really. Anyway, listen, unfortunately, we got a lot to talk about, a lot of issues, and we do have casualties. Anybody on the phone?
Yes, sir. Terry's on the phone. Good morning, Terry.
Morning. How are you?
Good. Can you hear him, Hank?
I don't have my headphones on, so, I hate headphones. I'm only putting them on for you, Terry.
It helps.
Well, I appreciate that, Hank. Thank you very much. It's good to have your undivided attention.
Well, you tell your wife to try that. You got a casualty, unfortunately.
Yes, sir, I do. Unfortunately, like I said, it's one of those times that we don't like to call in, but unfortunately we do. And if it's okay with you, sir, I'll go ahead and start.
Go ahead.
The casualty we have one casualty today is Deputy Sheriff William Kelly. And William was with the Covington County Sheriff's Office out of Alabama. His end of watch was April the 18th. William was killed during a traffic accident responding to an accident involving injuries. Unfortunately, he succumbed to those injuries shortly after the crash. He was 46 years of age, and his tour of duty with that agency was 8 years. And that's all we have for today, sir.
Oh, well, listen, be safe,
Yes, sir.
Listen, I saw the headlines this morning about crime rates dropping in Marion County, I guess across the state, but that doesn't happen by accident. It happens because of good law enforcement, too. So pass that along. We appreciate it. Okay?
I will. Thank you, Hank.
Thank you, buddy.
You're welcome. Bye-bye.
Is Brian or anybody on the line?
No, sir.
Okay. We do have one military casualty from the U.S. Army. He was killed in Afghanistan. Kerry Daniak, 27. He was from Texas, killed in action in Afghanistan this past week. And I know there were some shootings there this morning, but we won't get those for a few days. So I don't think there's anybody local that anybody wants to mention, correct? And Brian's not there. There is a fire casualty. I'll do it. I was going to wait, but his name was Hugh Ferguson. He was a volunteer firefighter. He was killed, died of a heart attack fighting a fire. And that's our only firefighter.
Tim Mahoney. Tim Mahoney's wife?
No, well, I'm talking about killed in action. I'll do the sick thing afterwards, yeah.
All right, we'll be right back.
Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
Yes, I do.
I'd keep you out of trouble if you brought your checkbook. I'm swore to secrecy. Hey, listen, we do have a lot to talk about this morning, but we do have a fundraiser coming up on May 3rd.
We do.
And you're going to talk about that real quickly, I know, and out there at Wayne's World, and a little paintballing going on.
Yes, it's a second annual Paintballers Give Back, and it's a charity event for veterans helping veterans. It's May 3rd, ages 10 and up, and it's $45 per person. You can register at waynes-world.com. It starts at 10 a.m. The game starts at 10. Registration is between 8 and 9 a.m. The game lasts from, I believe, 10 a.m. to 6 p.m.
Mm-hmm. That's about right.
And there will be food, and
the proceeds come to Vets Helping Vets, and we appreciate that. So we appreciate Wayne's World for doing that and all the good things they do, and it's good stuff. Gary, I want you to talk about Palm Chevrolet and Bob Wine's Nursery, if you would.
Sure would. We want to thank our sponsors, of course, WOCA Radio here, who makes it all possible, and Palm Chevrolet, a great place to buy a car. If you want to see the world today in your Chevrolet, Palm Chevrolet is the place to get that Chevrolet. Not only do they have a great line of cars, but they have hundreds of trucks, and they have to reduce this inventory, so you can get them at zero down, and you get to keep the rebate. So you need to go see the people at Palm Chevrolet today. They're located at 2300 Southwest College Road in beautiful Ocala. And if you do happen to buy that beautiful new Chevrolet truck, the first thing you want to do with it is drive it over to Bob Wine's Camellia Garden and Nursery and just fill that up with the wonderful things they have over there. They're located at 2610 Southeast 38th Street in Ocala. And when it comes to landscaping, Bob Wine's has what you need. If they don't have it, you probably don't need it. They have everything from flowers to trees to small plants to large plants, mulch, fertilizers, everything you could possibly imagine. And you can contact them at 629-5766.
Okay. We're going to do a whole show on with Ray Seaman's here in a couple of weeks, talking about the need for the schools to have more money so they can spend it on some of the programs in the school. I wanted you to meet these folks at the table because they're all influential. I met Ray about a week ago. We had a little talk about whether or not we could support it or not, and I think we can under certain circumstances, and we'll talk about that. But Ray, just introduce yourself and briefly, because I want to get the docs on, but briefly tell us where we're going and why you're doing it.
All right, well, yeah, my name is Ray Seaman, and thanks, Hank, for having me on the show briefly. I'm with the Yes for Marion Schools campaign, and we're working to pass the One Mill school funding referendum this November, which would help us restore a lot of the programs that have been cut so deeply in our public school system over the last 7 years, specifically reading, art, music, library, physical education, and vocational programs. Also helps us hire full-time state-certified teachers so we can reduce class size and get back to compliance with the class size amendment. Also helps us hire some paraprofessionals and teacher aides, all with oversight from an independent Citizens Financial Oversight Committee. So look forward to talking with you all more about that in the coming weeks.
Okay, well, listen, we will too. And again, I'm sure there are some folks who probably have an opposite point of view, and they're welcome to talk about that as well. So we'll arrange it and get it going and get the dialogue moving along. In the meantime, today we have Dr. Knapp, as you know, who is the director of the VA clinic here in Ocala, and a good friend of mine. Keeps me alive, kept me alive for the last 10 years or so anyway, Dr. Baccio. Some people are disappointed in that.
Then it's his fault.
Yeah. Vivian will probably go over and knock the tar out of him later on. But anyway, I've had good treatment at the VA clinic in a large part to Dr. Baccio here and Dr. Knapp. So they've got some issues and some topics they want to talk about this morning. I'm going to turn it over to you guys.
Well,
Thanks for coming.
Well, thank you, Hank. It's our pleasure to be back again. We get an awful lot of requests in the community to talk about male menopause, low T, and it was requested that we speak about this today. And Dr. Baccio is the longest running doctor at the VA clinic for about over 10 years, and he actually has completed a endocrinology fellowship at the University of Florida. So he's our local endocrinology expert, and we brought him here to discuss low T. So let me start, Dr. Baccio. Low T, there's been a pendulum swinging back and forth. We were very aggressive in treating low T many years ago, but now I'm seeing commercials about the dangers of treating low T. Can you tell us a little bit about what is low T?
Good morning to you all, first of all, and good to be here, and good to see Mr. Hank after a long time, and he's still intact. Good. Thanks about it. And speaking about the low T, yes, there is so much hype about the low T currently. Low T or low testosterone basically can be diagnosed by the blood test. Blood test is the only way to diagnose the low T. However, the reference values varies from lab to lab. So we got to be careful about diagnosing the low T. Only when you have a right reference lab, then you can compare and say that this particular person has low T. Idealistically, to define and to diagnose low T, it should be drawn, the blood should be drawn in the morning at 8 a.m. That is the ideal time. And if the 8 a.m. blood draw shows low T, then we have to repeat the testosterone levels again to confirm the test.
And how would you know whether you need a low T? What are some of the symptoms that our veterans who come to the clinic would have that would indicate that maybe they need to have a testosterone level?
Good question. The symptoms of low T are, some of them are specific, some of them are non-specific. I will address the non-specific first. The patient may say anything varying from low energy, fatigue, depression, and on the other hand, there are specific low T symptoms like the loss of body hair and loss of muscle tissue, erectile dysfunction, loss of libido, etc. So the symptoms vary, and sometimes there may not be any symptom. The patient had a total depression. It's a kind of blanket depression. It's very, very difficult to make it out of it.
Does the VA have any treatments for low T?
Yes, we do.
What kind of therapies do you like? Do we have oral medication, topical? As an endocrinologist, what therapies do you prefer?
Well, the preference varies from patient to patient, again, depending upon the suitability. But there are different forms of T, that we call TRT, testosterone replacement therapy. In short, TRT. There are shots, testosterone shots, there are patches, and there are gels. The patches do not go well with the patients most of the time because they do cause a local reaction on the skin. So most of the patients do not like patches, but the shots and the gel are more or less acceptable highly.
Good. And the VA has all that?
Yes, we do have.
I guess the biggest question is, if I had symptoms of low T and you put me on medication, do I get better? Do I feel better? Or how do you follow up to see whether there's any benefit from this therapy?
Right. Do you get better? Depends upon you. And of course, I see you back after giving the hormone, and I reevaluate your symptoms. And then again, as I said, I go back to the blood test, and I see where the testosterone before and now. And then depending upon how your symptoms, are they getting better or not? Some patients do get better. Some patients, they say, kind of vague in gray zone. But yes, we do monitor the blood test level and then adjust the doses accordingly.
And my experience is that when I place my patients on testosterone replacement, since the symptoms are so nebulous, weakness, fatigue, that I don't see a lot of improvement. Now, that said, I do have some veterans that have improved dramatically on the medication. What's your experience as an endocrinologist?
This is a very good question. Thanks for that. The answer to this is some patients are purely testosterone deficient, and in those patients, if you replace the testosterone, there is an ample chance for them to improve. On the other hand, some patients do have comorbid conditions which prevents them to experience the benefits of the testosterone replacement.
So if we have a large group of veterans that have low T, and we treat dozens of veterans, then some will respond.
Some do.
Some respond, and others just don't seem to feel any better, and those would be the ones that would actually take off the medication. treating low T is actually, I come from Citrus County, and when I was in practice, I saw a lot of weightlifters who used illegal testosterone supplements, and I can tell you off the top of my head that I've treated young men, 30 years old, who've had seizure disorders. I had one young man I met in the emergency room. He needed a heart transplant because he had heart problems from illegal testosterone, and this is totally different. This is medical replacement, safe therapy.
Right.
I wanted to move into what's happened in the last 3 months. When we all go home, we watch the news at night, and my news is filled with commercials about side effects of testosterone replacement. And there's recently been a government survey on bad side effects of this medication. What are some of the side effects of testosterone replacement?
Good. The testosterone definitely is a good hormone. However, it has its own side effects. The first and foremost is it does stimulate the prostate cancer. So we do not give testosterone to a patient with a history of the prostate cancer or with a history of breast cancers. Secondly, patients with a history of the heart surgeries, bypass surgeries, we do not. I always think twice before giving the testosterone replacement. And because the testosterone makes a secondary erythrocytosis, which is nothing but thickening of the blood from the hormone, this puts so much stress on the heart. So it has its own intrinsic side effects, and I'm always leery about giving testosterone in those patients.
And actually, I do have a patient right now who is a very close friend of mine who actually sees me as a patient who we placed on testosterone therapy, and his hemoglobin or blood count went to astronomical levels, and consequently set him up for a stroke or heart attack. And we had to, unfortunately, take him off the medication. I say unfortunate because he was one of these young men who actually was responding extremely well to the medication and felt so much better. And taking him off the medication, his hemoglobin and blood counts are completely normal at the present time. So the question is, what are we going to do next? I may ask you that when he comes back to the office again in a few weeks here. What other conditions or medications cause low T? Anything else that we should look for when someone has low testosterone?
Sure. Before I get to the answer, I would like to add up here a little bit. The National Institute of Health, NIH, does not recommend testosterone replacement in any patient after 70. Done. Period. Whereas the Endocrine Society says the same thing. It does not recommend any testosterone replacement in a patient with who has clear contraindications for the replacement. That said, moving on to the medications that cause the low testosterone, one of the most common medication that does cause the low testosterone is opiates, alcohol, anabolic steroids, and Tagamet, ketoconazoles. These are the common medications that do cause low testosterone levels.
Well, the average age of the veterans that come to the Cascades is in the late 60s. If I had to guess, I'd say it's 68 or 69. So 70 years old seems to be pretty low. What is the rationale for limiting testosterone replacement for patients that are less than 70?
Well, as per clearly there is no consensus about it, but NIH guidelines says the advantage or the benefit after 70 is questionable. So that's the reason they say rather than putting the patient at risk for the heart disease and stroke, it is better not to do any harm.
So that excludes a lot of veterans,
yeah.
Unfortunately.
Unfortunately, yes.
Recently, Dr. Baccio was referring to one of the guidelines that came out from the federal government that they did a study and showed there was almost a twofold increase in heart attack and strokes in individuals in their 60s and 70s that were on hormone replacement therapy. So I had another patient in the other day who had low T, but he had a history of heart disease. And I'm paying much more attention to that as an exclusion criteria now. I did want to make mention of one thing I want to talk about ED and how testosterone is related to ED. Viagra is one of the most common medications we prescribe in the VA. Unfortunately, we do have Viagra. Viagra is extraordinarily expensive if you get it on the outside, and the medications for the veterans are very inexpensive. But we're always asked the question about low T and ED. And the way I look at it as a practitioner is the following. Testosterone can actually augment erections if you have low T. And I do have some patients that tell me that their erections are much better with their ED on testosterone. But what you get with testosterone is a lot of side effects. You get potential heart side effects, strokes, and as Dr. Bosch has said, it can induce prostate cancer. And if you notice on the commercials, that's one of the exclusions when you're listening to your television set. But however, we do have lots of treatments for ED, and these are extraordinarily expensive, such as the intraurethral pellets, the Viagra, and even shots. And one of the benefits of coming to the VA, they're very inexpensive. So if the primary problem is not weakness or fatigue, it's purely erectile dysfunction, lots of times what I like to do as a practitioner is move on to the other medications and not to use the side effects of testosterone replacement.
That's true.
Okay, well, very good. And what about thyroid? What about thyroid problems? How does thyroid relate to low T?
Well, thyroid per se, actually, not necessarily within low T, even with insulin and with other hormones, the way the thyroid influences, it acts as a synergistic with other hormones to express their action. That is the action of the thyroid. It does not really play a direct role, but it helps the other hormones express their abilities and potentials.
Good. And I should just make another attaboy for the VA. When you come in for your blood work yearly, almost uniformly, do we check a thyroid on a initial basis and a yearly basis. So I had my 8 o'clock patient this morning, wondered whether we ever checked him for thyroid because he had a family history of thyroid problems, and the answer was 10 times in 5 years. So that's included in our blood work, and we're pretty compulsive in checking on that.
Yeah, your lab is actually very comprehensive. I mean, even my outside doctors, and I have both, and I use Dr. Boscher, but they always comment about the VA lab and how comprehensive the tests are and how thorough they are when because I share it with them, and it's impressive. And this clinic, I won't say that all VA clinics operate like this clinic does, and we know that they don't. But this clinic operates pretty well, and I think it's thanks to particularly you two folks and all the other good folks over there. So we're appreciative of that, really.
Let me say one more thing. We're actually up to between 32, 35 new veterans every single week that are now enrolling in the clinic. Right now we have 11,000 veterans, and we're adding almost 2,000 per year.
Okay, real good. Listen, this half-hour show has us on kind of a tight rope, but, hopefully you're going to keep on coming back at least once a month and have a
Yes,
topic.
sir.
You know what you're going to talk about next time?
No, we're going to discuss it after the show.
Okay.
Let me talk to you for half a minute.
Go ahead.
Well, this is definitely very encouraging, and I do encourage meetings like this, and this is really heartening to see Hank after a long time. And
well, you won't see me as a patient anymore. That's what they told me.
I thank you all for your time and attention.
Well, thanks for coming over. It's good to see you.
Yes.
Got a couple of sick calls. Trish Mahoney is still not feeling real well, but getting on her feet. And John Dinkins is back in the hospital, not doing so hot. But they're on the mend, and hopefully they'll get better. Our well wishes to them. I didn't mean to ignore you, Sergeant Curley, but if you got anything quick, I know you usually have something going on.
Oh, yeah. South Fifth Avenue VFW Scramble Golf Tournament at the Pine Oaks Golf Course in Ocala. It's going to be Saturday, May 10th on 2014. Registration starts at 8 to 8:30. Shotgun start. And for more information, you can call Lizzie Lennon at 352-351-3599 or Dennis King, 347-961-6698. All proceeds go to the Brady Owens Community Center /VFW Post 7193.
Two real quick things. We're still working with Habitat. That's moving forward very aggressively. We went and looked at some properties the other day. That's all has to do with building houses for veterans, and we're moving very aggressively on that. The other one is working with the Symphony Orchestra to provide some therapy for some veterans with PTSD and some other issues, and hopefully we'll talk with the VA a little bit more about that today and see if we can't partnership on that. So a lot of great things are happening in Ocala, and we really appreciate all the support we get. And Gary, if you just mention one more time, you don't have to do the whole thing, but Palm Chevrolet. And,
thanks again to the folks at Palm Chevrolet and Bob Wines, Camellia Gardens and Nurseries. And when you go down there, make sure you tell them you heard about them on WOCA during the Veterans News Time.
And Mike Sizemore sitting behind him. I had to get his name on. Thank you, Mike. Thanks, guys. Appreciate your service. God bless America, everybody.
Yeah, sure.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Lillian Wu. Murder at an Afghan hospital as a guard assigned to protect it turns his gun on a group of doctors, killing 3 American physicians, injuring a
A
nurse.
spokesman for the Interior Ministry says he's now in custody.
Police has arrested the attacker as well, so we will investigate to find out the motives behind this attack.